Hey folks, welcome to Medicare 101. This is Randy Bond with Bond Insurance Solutions. I am so glad that you've joined us today. We are talking about one of the areas that can be confusing about Medicare and can be very costly, and that is prescription drug coverage. I see a lot of seniors that struggle with getting their medications, being able to find and pay for them, or just being able to figure out how to get the right coverage. There was a study that was done that showed that 80% of Medicare beneficiaries are in the wrong prescription drug plan. So we want to help you out on how to choose the right plan, how the plans work, and maybe how to save money on your prescription drug coverage. So thanks for joining us today. Let's get started here with Medicare 101 Part 4, Prescription Drug Plans. So let's talk first off about what prescription drug plans are. First thing, prescription drug plans or Part D plans, PDPs for short, are very simple. All they do is cover your prescription drug coverage. So anything that you would need at a pharmacy from behind the counter, this is the kind of plan that you would use. Now, this does not typically cover over-the-counter benefits like non-prescription things like aspirin and Tylenol and so forth. It's only going to cover your prescription drugs, thus the name, prescription drug plans. Prescription drug plans are only offered through private health insurance companies, so you can't get prescription drug coverage directly through Medicare. You get your original Medicare through Parts A and B, but Part D is only through private health insurance companies. Now you can have your prescription coverage in a standalone prescription drug plan. So if you're on original Medicare, maybe you have a Medicare supplement to go along with that, you can get just a standalone Part D plan. Another route to go is to get your Medicare through a private health insurance company, and that's known as Medicare Part C or Medicare Advantage. Both of those mean the same thing, and most Medicare Advantage plans include the prescription drug coverage in there at no additional premium. So that can be a real nice help there to have just a kind of an all-in-one package. But just know you've got a couple of different routes. No matter how you're getting your Medicare, you can get the prescription drug coverage. So let's talk about how the plans work. First off, every plan is going to have what they call a tiered formulary. Now we're going to get into some big words here, but we're going to unpack those. So don't get the glossy eyes. So all the plans are going to have this thing called a tier formulary. A formulary is simply a list of the medications that the plan covers. So each plan has its own formulary, its own drug list that they're going to do. And the covered drugs are going to be grouped according to cost, and those groups are called tiers. So most of us have heard of tier 1 medications and tier 2 medications and so forth. And generally, the lower the tier, the lower the cost is going to be. Let me just quickly mention on the tiers, it's the drug plan that sets the tiers. So it's not the drug manufacturer. So like Pfizer or Bayer or whoever makes it, they're not the ones who set the tier. Medicare doesn't set the tier. The pharmacy does not set the tier. It's actually the drug plan. And this is important because you can have a medication that you're taking that might be a tier 2 on one plan, but with a different company or even a different plan within the same company, it could be a tier 3 medication. Gabapentin, which is a generic medication that's typically taken for neuropathy or nerve pain. I have often seen that one fitting that very example, where on many plans, because it's a generic, it can fit into that tier 2. But there are some plans that will cover that as a tier 3 medication, which means your cost could be higher on that plan that has it as a tier 3 rather than on a plan that has a tier 2 listing for that particular medication. So this is going to be the starting point for any good agent that's helping you out. They're going to help walk through the list of medications that you're taking. And number one, make sure that the plan covers it. And then number two, how the plan is going to cover it, what tier level that has for that particular medication. Now, Medicare has set up various stages, about 4 distinct stages that you could possibly go through. And the stages are based on the cost of your medication. So what graduates you from one stage to the next is how much the retail price is on your medication. Notice I'm talking about the retail price, not what you actually pay. So that's an important thing. So let's talk about the stages. We'll talk about what they are, how you move from one to the other. And then on the next slide, we'll talk about what you would typically pay. Now, I don't have real life examples. If you want to know what that is, you can contact me. I can certainly let you know. But just generally speaking, this is how this would work. So the first stage would be the deductible. Now, this is an optional thing. Not every plan has a deductible. And that deductible could possibly be applied to all tiers of medications, or it could only be applied to certain tiers. So I've seen a number of plans that there's zero deductible on tiers 1 and 2. Now, tiers 1 and 2 are typically your generic medication. When you get to tier 3, let me in fact go back to that. That'd be an important thing to know. Tier 3 is where you're starting to get into name brand medications. So you might be seeing ads for this on television, or you've seen all those ads. Here are all the ways that you can die if you take this medication, sort of thing. But if they're doing the ads for it, typically it's a name brand medication. That's tier 3. Tier 4 is also name brand, but they're the non-preferred name brand medications. Tier 5 is where you're starting to get into specialty kind of medications. Those are a whole lot more expensive. Most people that I see are typically in tiers 1, 2, and 3, with a few people having 1 or 2 tier 4 medications in there. For the vast majority of people that are just kind of taking some maintenance medication, for blood pressure or diabetic blood sugar management, those kind of things, those are typically your generic kind of medications, and those are definitely cheaper. So going back to the stages, if you have a deductible, Medicare sets the maximum deductible as $435. So this means that plans may or may not have a deductible, and that deductible could be $435 or less. So that's an important thing to know. Now, here's where people get a little bit confused. A deductible is not an extra amount of money that you pay. This is the stage where you're going to pay the full price of the medication. So if you have a deductible, that means the insurance company is saying, we will start helping you after you have paid $435, the full price of the medication on your own. And then we'll start helping you out. So you're just simply buying your medication almost as though you had no insurance. That's kind of what it will feel like. But you're not paying anything extra to the insurance company, and you're not paying anything extra to the pharmacy as like, here's my $435, now let me start getting my medication. You're meeting that deductible by simply purchasing individual bottles of medicine. And once that all reaches that deductible amount, whatever that is, that's when you graduate to the next stage. Now, the next stage is where you start kind of getting a little bit of a breather in many cases. The initial coverage phase is when you're going to pay a set copay based on the tier of the medication. We'll talk more about that. But you'll stay in the initial coverage phase until the total drug cost, again, that's the retail price of the medication, reaches $4,020. So tier 3 medication, a lot of plans might have you paying in the neighborhood of $45 if you're in the initial coverage phase for tier 3 medication. Now, that medication may be an $800 medication. So when you get your receipt from the pharmacy, typically it'll list, here's the retail price, and here's what you paid, and maybe here's what the insurance company is covering on that for you. So if you had something like insulin, and that's a tier 3 medication, and let's just say, for an example, that was an $800 medication, you're only paying $45 during the initial coverage phase to the pharmacist, but it's worth $800. So what that means is $4,020 divided by 800. If you get 5 months worth of that insulin, or 5 vials, however that works out for you, then you're going to graduate out of the initial coverage phase after just 5 times of doing that, after maybe 5 months. And that's what's going to take you to the next phase, the coverage gap. This is famously known as the donut hole. Now, the donut hole, you're going to stay in that until your total out-of-pocket cost reaches $6,350. Now, that does not include your premium, but that's basically everything that you're paying or what's being paid on your behalf by the insurance company or by discounts from the drug manufacturer. All that reaches $6,350. And that's where you would graduate and go to the next and final phase, and that's the catastrophic coverage. And you'll be in that for the rest of the year. Then on January 1st, it all resets and you would go back to the deductible phase if there is one. Now, if there's not one, you just automatically start at the initial coverage phase. So cost are going to play a big difference. And that's one of the keys for picking the right plan, because every single medication has a different negotiated price by an insurance company. Here's two things I know. Number one, I was looking to see if I had something around here. We'll just pretend like this mug is a bottle of medicine. If you were to go to the pharmacy and ask the pharmacist how much your medication is, they wouldn't be able to tell you. Not until you presented your drug card, because every drug plan has a different negotiated price with the same pharmacy. And so unlike getting like a bottle of Coca-Cola at the store, and you know this is going to be whatever price that Coca-Cola is, regardless of if you're paying by cash, check, or credit card, it's just going to be the same. Prescriptions don't work that way. There's a different price that every drug plan has with that pharmacy for that particular medication. And the stage that you're in is also going to affect the price as well. And so it's hard to just walk up to the pharmacy and say, how much is that bottle? They may not be able to tell you. Now, a lot of pharmacists will have a cash price. This is kind of, if you don't have any insurance, this is what it would be. But when you're within some kind of insurance plan, they're going to have a negotiated price with that. And that makes a difference. The second thing is, I know that doctors do not know how much medicine costs. And that's kind of important to know, because you need to be a little bit aware of how your plan works, and maybe even have your formulary nearby, so that you can avoid going to the pharmacy to pick up your medication and the pharmacist says that'll be $800 because your plan does not cover that medication. We'll talk a little bit more about how to get around some of those kind of things in just a moment. But just understand, your pharmacist doesn't know how much medication costs, and your doctor doesn't know how much medication costs. Now, your pharmacist will know, but doctors generally just don't. And we'll talk more about that in just a moment. So how much does it cost during each of those stages? Well, again, during the deductible, you're going to pay the full price of the medication and up to the deductible amount. So that's an important thing to know. So if you've got an expensive medicine, you could be paying out quite a bit. So for a lot of people, January can be a painful month, and you need to kind of be prepared for that. The second thing to know is that during the initial coverage phase, you're going to pay a set copay based on the tier of the medication. So again, generally lower the tier, the lower the cost. So you might have a tier 1 medication in your plan, and it'll have a list that if you go to a preferred pharmacy and you get a 30-day supply of a tier 1 medication, you'll pay $3 a bottle. Now, typically that's $3 or the actual price, whichever one is lower. So if you have a $1 medication, you'd only pay the $1 there. So tier 2, you might pay $8 or $10. Tier 3, you might pay $45. Tier 4, you might pay $100. Now, these are not exact quotes. I'm just giving you some ideas, because the plan's going to vary according to your area. So don't say, Randy Bond said I would only be paying this. It all depends on what your plan is, and it will tell you how much it would be for each of those tiers. Now, the donut hole is where you could see prices generally go up, but some might go down, because you will pay 25% of the retail price of your medication during that time, whether it is brand name or generic. Now, you have heard that the donut hole, maybe you've heard this, that the donut hole is going away. Well, it used to be that during the donut hole, you paid 100% of the cost of your medication. Congress has gradually been reducing that, fortunately. But as they set up the prescription drug plans years ago, back in about 2006, they said that the maximum amount could be 25%, and that's where we are right now. So there still is a donut hole. You're just paying the maximum amount, which is 25% now, rather than what it used to be, 50%, 100%, and it was just horrible for people during that time frame. Now, if you go into the catastrophic coverage, you would either pay up to $3.60 for a generic, $8.95 for a brand name, or 5%, whichever one of those is greater. So if you've got a generic and 360 is lower than 5%. It's 5% were $10 worth of drug. You'd pay $10 for generic rather than the 360. So let me just mention right here on these stages, you may not go through all the stages. Again, it all depends on what medications you're taking, how many of them you're taking, and what the retail price is of that. If you're just taking generics, chances are you might only be in the deductible phase for the entire year. Or you could be in the deductible for part of the year, and then you're in the initial coverage phase for the rest of the year. Now, for some people, you could be in the deductible phase for January. You could be in the initial coverage phase for February, and then you're in the donut hole for the rest of the year. Or in the worst case scenario, you're hitting the donut hole early, but then somewhere toward fall, you're hitting the catastrophic coverage. So again, it all depends on what medications you're taking, how expensive they are, and that's all going to drive you through the different stages. So it's the retail price of the medication that's kind of moving you through each of these stages. And you do not go through all the stages. You may not. Let me put it that way. Some people do, but not most people that I work with do not typically see the catastrophic coverage, although we do have some that do. So all that to say is that what you can pay for your medicine can fluctuate throughout the year. It may be that if you've got some expensive medicines in there that you can see your prices go up and down and up and down throughout the year. I mean, you've got 4 possible stages that you can go through, and you could be paying a different price during each of those stages. So let's use an example. We've got Bob who's taken a tier 3 medication, and it has a $400 retail price. And so during January, we're going to assume that he has a deductible on there. Now, we're going to also assume that he's maybe taken a couple of other little medications to go along with this. So in January, because he has not met the deductible, he pays the full retail price for that $400 medication. And so he is forking out $400 to the pharmacist. Well, fortunately, that's all that he needed to do. And so in February, he's now moved into the initial coverage phase. So during the initial coverage phase, let's say that on his plan for tier 3 medication for a 30-day supply, his copay is $45. So if you look, February, March, April, May, and June, he's paying $45. But because he's taken some other medications in there, he hit that $4,020 mark in total prices of his medication. And so he now is moving into the donut hole. So remember, the donut hole is where you pay 25% of the retail price of your medication. So in this case, for that one medicine, he'd be paying $100 a month. And so that'd be $100 for July, August, September, and October. But because he still had a lot more medications in his group, he now moved into the final phase, which is the catastrophic coverage. So the catastrophic coverage, let's say this was a brand name drug. And remember, the most that you pay for a brand name drug is either $8.95 or 5% during the catastrophic coverage. Well, 5% of 400 is $20. So $20 is greater than $8.90, so he's going to pay that $20 for November and December. Well, January 1st, it resets if he stays in the same plan, and this is kind of what it would be if everything stayed about the same in his plan. So I'll just show you this to let you know that your prices can fluctuate. Now, when I'm working with my clients, what I do is we start with the medications that you're taking, and I can let you know how much your medications would be based on the medications you're taking right now. So if your doctor adds something in during the year, that could change things a little bit. But this would be what you could expect to pay each month based on the snapshot of the prescriptions that you're currently taking. And so that'll give you an idea of how to plan for when you're going to the pharmacy, when to expect the shock, when to expect maybe the higher prices, when you can maybe breathe a little bit during that. And so we want to try to help you plan accordingly. And sometimes that can make a difference on which plan we choose. Sometimes if you go with a higher premium plan, it may reduce or eliminate that deductible. So if it would be difficult for you to fork out several $100s in January, we try to look and see if there's a way that we can maybe equalize the payments that you're doing to the pharmacy over the course of the year as much as we can. Sometimes our hands are tied, but we want to try to help you figure out, do you want the lowest total cost for the year, or do you need to manage your cash flow each month? Now, on that note, let me just mention that Social Security does have a program called Extra Help. It's also called Low Income Subsidy, LIS for short. And so it's a good thing to kind of ask, because probably 40 to 50% of all Medicare beneficiaries would probably qualify, at least in our area, for extra help. So anyone who has Medicare can get extra help if you meet income and asset qualifications. So extra help is going to help you with your monthly premiums for your Part D plan, and your deductibles can make those deductibles go away, and it can help with copays so that you're paying a lower amount whenever you're getting your medications. So for 2020, this is what the income and asset limits are. So if you're an individual, if you're making $19,140 per year or less, you can qualify. If you are a married couple and you're making $25,860 a year or less combined income, then you could qualify, as long as your assets are under a certain limit as well. So for an individual, your assets need to be less than $14,610. For a married couple, your assets need to be less than $29,160. Now, assets do not include your home. So you can be a homeowner, and they're going to exclude from your assets your home that you live in and the property that that home is on. It's going to exclude the car, the furniture, and some of those kind of personal possessions. So those would not be counted in. Typically what they're looking at is how much do you have in your checking and savings and retirement plans, if you have one, and do you own another piece of property, another house, or things like that, a second car. Those kind of things would be counted as assets. So as long as your assets are below that, you could qualify for this, and that would help you. Social Security estimates that this can be the difference of $5,000 a year benefit for people if you qualify. So I see a lot of people who are struggling with, do I buy my medicine or do I buy my groceries this month? Listen, if you're in that case, contact me. Let's see if we can help you get started with that. Be glad to help you out. If you're watching this and you know somebody that might benefit from that, would you just stop right here, maybe be a good friend, and maybe share this video with them so that they can see if there's a way that they might be able to qualify for this. Now, I understand you may not know their whole situation, but this could be a way that if they do, it could save them quite a bit. I have seen people save literally thousands of dollars by being able to get the extra help. It's a good thing. So let's talk again about the drug plans. All the plans are going to have what they call a pharmacy network. So it's the pharmacies that they tend to work with. So if you go to one of those pharmacies, your drugs are going to be covered. If the pharmacy that you're using is out of the network, or if you go to a pharmacy that's out of the network, you would pay the full price of the medication at that pharmacy. So that's just something to be aware of, that you want to make sure that the plan that you're getting actually covers the pharmacy that you're going to. So the two big considerations is, are my medications covered by the plan, what level they're at, and then is my pharmacy in the network? So most of these plans have a vast network of pharmacies. It's hard not to find a pharmacy that's in the network. But some of the plans are going to distinguish, if they do have a network, they're going to have network, but they're going to distinguish between preferred and standard pharmacies. So at a preferred pharmacy, you would pay a lower rate than you would at a standard pharmacy. So the pharmacy that you're using could have an impact on the price of the medication that you get, how much you would actually pay. So if the pharmacy is out of network, you're going to pay the most. If the pharmacy is in the network, but it's a standard pharmacy, you would pay more than if your pharmacy is at as a preferred pharmacy within their network. So that's one of the things that we will look at, is what medications that you're taking and what pharmacy that you go to. So we try to see if, without any kind of changes, you can get great coverage with minimal change on your part, because we know change is hard. You like your pharmacist, they know you, they take care of you. And sometimes though, every now and then, it's not often, we might suggest, have you considered maybe another pharmacy? Because that could help save significantly. By the way, a lot of plans are going to have a mail order pharmacy. And this is where you could probably save significantly. A number of the plans for their generics, tier 1 and tier 2, they may have a zero copay if you use their mail order pharmacy. They'll automatically send you a 90-day supply, and you don't pay anything for those generics if your plan has that kind of thing. Now, some plans will have the mail order pharmacy, but they'll have a discounted rate if you use their mail order pharmacy. So just something to be aware of. Just a few other things to let you know about how a prescription drug plan works, what's going to be within every single plan. Number one is going to be step therapy. So if your doctor prescribes to you a brand name medication and there is a generic equivalent of that medication, the the drug plan is going to get you to take the generic first, if possible. So they will say, nope, we're not going to cover the brand name. We need you to try the generic first. Now, there are a couple of different ways that you can get around that. Number one is you try it and it's not working. And so that's when they would cover the brand name for you. Or if your doctor has previously tried that with you and it just has not worked, it's made you sicker, you've had some kind of reaction to it, then the doctor can say, we need to go ahead and do the brand name. The third is if the generic formulation has something in there that you might be allergic to. For instance, you can have a brand name drug that does not have gluten in it, and if you're gluten intolerant like me, this can be a big deal. And the generic version does have gluten in there. So that could be a reason why an insurance company would go ahead and cover that brand name drug for you. So step therapy is one of those things that you could get some pushback from the insurance company. You've got this new brand name drug that the doctor's prescribing. There's a generic available. They may say, let's hold off on the brand name. We'll cover it if the generic doesn't work, but we need to see if the generic will work. This will help save you money as much as it saves them money. And that's what they're trying to do, is look out for you as much as for their own bottom line, quite frankly. Now, there may be quantity limits on some medications. And so that's another one of those things that we would take a look at, because there are some high octane kind of medications that, because of the label warnings and so forth, that if you take too much, it can have some effects that are not good. And this is just one of the ways that they are trying to protect you. So we want to try to find that the balance between what your doctor is prescribing and what the quantity limit is on that particular medication without any hassle. But that is something to be aware of, that some medications may have quantity limits on there. Some medications may require prior authorization. Again, it's just another one of those checks, just a cautionary thing because, of what the medication could be taken for. They just want to make sure that it's being administered safely. And so this is where the doctor might just need to contact the insurance company for you and say, yep, we're taking it for this particular issue, and this is the medical reason why. Now, you can ask for exceptions. This is the fourth one there. So it's the middle of the year. Your doctor prescribes a new medication for you, but it's not covered by the formulary. In most cases, when you have a medication that's not covered by the formulary, again, doctors don't know what the plans cover. It's just too much information. They're human. They can't keep up with all that. I can't keep up with all that. And so it's possible that a doctor may prescribe you a medication that's not on your drug plan. And so when you get to the pharmacy counter, the pharmacist says that'll be $800, and you have a heart attack there. You get mad at the doctor, you get mad at the pharmacist, but then you begin to remember, oh yeah, Randy Bond told me that not every drug plan covers every single medication. And so it's possible at that point that you can just simply call the doctor's office and said, hey, with my drug plan, this is not covered. Is there another equivalent that we could take that would be just as good? And in many cases, the doctor can say, not a problem. And so they'll write a prescription for a different one. It's covered by your plan, and you walk away a lot happier, and the same therapeutic effects. However, you may be prescribed a medication that's not on the formulary, and another one may not work for you because you're allergic to it, or for whatever reason it is. At that point, you can have your doctor's office request a formulary exception, so that the drug plan will make a decision, usually within 72 hours, and say, yep, we'll go ahead and cover that one for the rest of the year for you. And so they would say it's going to be a tier 2 or tier 3 medication, and that's how we'll cover that. So however that falls in, that could be any tier, by the way. I was just using that as an example. Now, utilization, They could possibly request an exception based on how many, quantity limits, and so forth. But a tiering exception is also a possibility. Tiering exception is where you get your doctor to request that maybe a medication be covered at a lower tier so your costs would be lower so that you can actually afford to get the medication. Now, that one may or may not be done, but it is always worth asking, if this is a special kind of situation, particularly if it's a new medication that you need to take and they hadn't been covering it before, you weren't taking it before the year started, and that might be a possibility. Um, so when can you enroll in a prescription drug plan? Well, you can enroll during your initial enrollment period. So when you're turning 65 or you're new to Medicare, when you're turning 65, you've got that 7-month window. So the month that you're turning 65, the 3 months before, and the 3 months after. If you need more information about that, we did a video on when and how to enroll in Medicare, and you'll see that link here. So if you need more information on that, you can do that. But that 7 months around your 65th birthday is when you can enroll in a prescription drug plan. So when you retire, so if you put off enrolling in Medicare Part B, or you put off taking advantage of Medicare until you actually retired because you had group benefits, then when you retire, you have a 63-day window. It's called a special enrollment period that you can sign up for a prescription drug plan. Or you can sign up for a plan or even change plans during the annual enrollment period, which runs from October 15th to December 7th of every single year. So if you missed your initial enrollment period or you missed your special enrollment period, then you could sign up for one during the annual enrollment, and that would take effect for you on January 1st the following year. I don't recommend skipping and then enrolling later, and this is why. Penalty alert. Medicare doesn't require you to sign up for a Part D plan when you're turning 65. But if you wait, there would be a penalty that would be assessed to you. So if you put off getting your prescription coverage and you don't have creditable coverage with your employer or the VA or tribal benefits, then Medicare is going to assess you a penalty that will be added onto your monthly premium for every month that you were not enrolled in that plan. So for instance, if you waited 5 years, you turned 65, you weren't taking any medication, and you thought, well, I don't need a prescription drug plan. I'm in good health, I'm not taking any medication, why do I need to spend that monthly premium? Well, if you wait 5 years and now the doctor's saying, hey, we need to get you some medication, or you know your health is moving in that direction, and you're thinking, nah, now I need to get a prescription drug plan. Well, 5 times 12 is 60. So the penalty is 1% for every month that you were not enrolled in a plan from the time that you were first eligible to enroll. So that means that you would have a 60% penalty added on to your monthly premium for the rest of your life. And so that would add on a significant amount to your premium. It could double or more your monthly premium. I've seen people that have been without one for 10 years, and now it's 120% penalty that's added on there. And that makes it almost cost prohibitive, but they're now in a desperate situation that they're having to pay an extraordinary amount of money in order to get their prescription drug plan so that they can get their prescription coverage. Folks, you can get an inexpensive Part D prescription drug plan. There are in many markets those that are less than $20. I don't know if it is in yours. I can certainly check for you. But in a lot of markets now, you can get something for less than $20 a month, and it is worth doing that. Now, I always hear people say, "Well, that just is unfair of Medicare to make me pay a premium when I don't need it." Blah blah blah. Well, you know, we do the same thing with our car insurance, don't we? And we do the same thing with our homeowners insurance. I mean, we don't want to ever have to make a claim with our homeowners insurance. And so we pay that every single month. And so it just makes a lot of sense. It's just like any other insurance. We pay the premium even if we don't need it. And if we do, well, that's just an added bonus. We're glad we had it there. So let me give you some tips for choosing the right plan. Number one is to start with the medications that you're currently taking. Don't start with the brand. Don't start with the premium. Start with your medications, what you're actually taking, and make sure that the plan is tailored to what you're actually taking right now. and then see which plan has the lowest annual cost based on your list at your pharmacy. And this is what a good agent can help you do. We can plug it into Medicare's information. Medicare knows the price of every single medication at every single pharmacy in the country with every single plan. And we're able to see, based on the pharmacy that you go to, the medicines that you're taking, which plan is going to have the lowest out-of-pocket cost for you. And so buying by brand name is not going to be the best approach. All the plans work exactly the same. So whether you've heard of the insurance company or not, they're going to work exactly as the name brand that you've heard of before and maybe trust. And buying by premium really does not guarantee any better protection. I've seen some people make some costly mistakes where they're paying a $75 a month premium and they're taking just a few generic medications. And they're doing that with the hopes of, if something happens, I'm going to be well covered. Well, the good news is you can change your plan every single year. There's no underwriting questions. It's an automatic acceptance so that you can move from one plan to the other every year. So take advantage of that annual enrollment period. What you want to do is tailor a plan for the year, not for life, because you can't predict what life is going to be like. And there's no reason for you to overpay for your plan. Again, something like 80% of people are in the wrong plan based on their medications. What that means is if they simply change their plan, they could save money. That's the bottom line. The wrong plan is they're paying too much for their medication. And so Medicare gives you an opportunity from October 15th to December 7th every year to review your plan. So there's a couple of things that can happen that can affect your coverage for the upcoming year. One is you may be taking different medication than you were the year before. And so there may be another plan that could save you money by simply changing that. My dad is a good example. He'd been on the same plan for 10 years. And he'd been taking pretty much the same medications and they'd still been covered pretty much the same way. But then he was prescribed a new medicine. So when the annual enrollment period came around, I said, Dad, let's take a look at this. He's like, no, this company is taking great care of me. And I'm happy with them. I don't want to change. I said, well, let's just take a look for giggles and grins. Well, by simply changing from one plan to another, he was able to save $1,000 on that one medication. And the only change for him was he paid $1 less per month in premium, and he just simply gave the pharmacist a different card in January. That was it. The change is minimal for doing a Part D prescription drug plan. I mean, you just simply take a new card to your pharmacist at the beginning of the year. Your premium might pay a little bit, but overall, your cost could go down. Now, there's a second thing that could happen, and this could be the invisible thing that you're not thinking about, and that is a plan can change what they're going to cover and how they're going to cover it for the upcoming year. Now, your plan about September is going to send you what's called an ANOC, an annual notice of change, and they'll tell you in there how the medications are, any changes in the coverage for their medication. And it's not going to be based on what you're taking, it's everything. So you might need to look a little more carefully in that. But what that means is the medication that you're taking may not even be covered by the plan for the upcoming year. That's a worst case scenario. So that if you just stayed where you were, you just assumed everything is going to be the same, January 1st rolls around and oh my goodness, now you're having to pay the full retail price and you can't make any change until the next fall. The second thing is that they could change the tier of the medication. They could raise it or lower it. So that means that it could either actually be a better thing for you if you stayed where you are, or it could be worse financially. And so a good agent can help you look through and see and do a review with you every year. We contact all of our clients every year when Medicare season comes around and says, hey, let's do a free evaluation of your drug plan and just make sure you're in the right plan for the upcoming year. Plans don't reward you for loyalty. And so there's no need just to hang on to a drug plan because you've had it forever or because you don't like change. I know when you get into your senior years that it gets harder to change. This is one of those things, particularly if you're taking some expensive medications or you're taking a lot of them, that you probably need to visit with your agent every single fall just to make sure you're in the right plan. So if you do want to explore or enroll in Part D drug plans, feel free to give me a call, or you can shoot me an email and we can certainly help you out. Uh, or we can do an in-person appointment if you're kind of in the local area, or we can do it virtually by video, kind of like we're doing right now. Now, I am a licensed Medicare agent. That means I have to be certified every single year by Medicare in order to offer plans, and I'm licensed in Arkansas, Oklahoma, and Texas. So if you're in that area, would love to help you out if I can. If you're not in that area and you're trying to find an agent, I might be able to help you out. You can shoot me an email. We can see if we can get you connected with somebody. Now, as an independent agent, I'm not affiliated with any particular company, so I'm not trying to sell any plan. I'm trying to find the right match for your situation. And I'm also not affiliated with Medicare, CMS, or the federal government or any federal agency in any way. Most Medicare agents are not. So I'm so glad that you joined us today. Hope this answered your questions. If you still have some questions, you can contact me or leave it in the comments below. If you found this to be helpful, I hope that you'll like this and share this, and maybe even subscribe to our YouTube channel here. Hey, thank you so much. Look forward to hearing from you. And if there's any way that we can help you out, I hope that you will. Hey, join us for our next one. We're going to be talking about Medicare Advantage and Medicare Supplement plans, and trying to figure out which is the right path that you might want to go down for taking care of your Medicare needs. Thanks again, and we'll look forward to seeing you next time.